How do doctors do it? How do they cope with death and sorrow and tragedy and all of the emotional baggage that comes with caring for ill patients? Sometimes it turns out they don't handle it very well. In this week's Science Times, we review a new book by Danielle Ofri called What Doctors Feel. Dr. Ofri joins us today to tell us more about it. Welcome, Danielle.
Thank you.
So I think a lot of patients have this idea that their physicians are sort of superhuman automatons, that they aren't really affected by a lot of the sorrow in the environment in which they work. You say that's not true.
It's not true at all. I mean, for starters, doctors are still people. Even if you've learned a scientific method and medicine, it doesn't change the fact that you're a human being. I mean, we could all be diagnosed by computers that might be very efficient, but I don't think you'd feel very cared for as a patient, and so most of us prefer to be taken care of by human beings. And human beings experience emotion even if they don't want to acknowledge it, they still are.
So you're an internist at Bellevue, which is a notoriously demanding environment in which to work. Just you personally, how do you deal with it? How do you lose a patient and then go home and make dinner?
Well, I've been at Bellevue now for more than 20 years, and it's an amazing and wonderful place to work. And it is very real, and I think that the joy is the connection with patients, with people, to be part of their lives. It's a true honor. And with connection also comes sadness and loss. And it is sad when a patient dies, and I think if you don't feel sad when a patient dies, you've lost something. But it's a privilege to have been able to connect enough to then feel that loss. So it reminds me that we are real human beings connecting. Do
doctors compartmentalize their grief and sorrow? I mean, I can't say I've ever seen a doctor break down in an examining room, or you never hear of surgeons running out in the middle of an operation.
I mean, to some degree we have to. You don't want to break down while you're with your patient while you're operating. But I think that if we don't find a space to give it its due, then there's a problem. So sometimes it would be after work or with a colleague or with your family that you then give that grief and sadness its due so that you don't keep it completely walled off.
So your contention in the book is that a lot of negative emotion is impacting the way in which healthcare is delivered to patients. Could you tell us some of the ways in which that happens?
Well, I think there are a couple of ways in which we see that. So one example is malpractice suits. So when doctors are sued, which is very common, it's a devastating experience, personally devastating for most doctors. I mean, there are probably a few quacks out there, but most people who get sued are practicing pretty good medicine, and maybe there was a bad outcome. I think for many doctors, the lawsuit feels like a personal attack on their professionalism, their dedication, and it can be very hard to recover. It's as though someone cheated on you, and many doctors are much more closed after that and are less likely to engage a patient. They may change how they practice much more defensively, over-order tests just to be careful. And over-ordering tests, as we know, has definite downsides on patient care.
So what do you think a patient wants from a doctor? Or is there no consistency at all?
Well, I think when you talk to patients, the first thing they say all the time is, I want to be heard. I want the doctor to hear my story, me as the individual. Because again, you could type in your symptoms into a computer and they could spit out a diagnosis, but that wouldn't feel as though you were really being taken care of. I think when we're sick, we want to be cared for, medically, but also for the rest of our lives, how the illness impacts ourselves and our families. So I think patients want the doctor to hear their story, hear who they are, how the illness affects them, and then take care of the whole person.
The book is What Doctors Feel, How Emotions Affect the Practice of Medicine. Thanks for joining us today.
Thank you.